So, what is the United States of America model for health? Well, for most working people under 65, people who have not reached old age, the model is close to what they do in Germany and Japan, whereby companies and individuals can buy health insurance. The only difference in America is that the American health insurance companies can be for-profit enterprises, which does not happen in other countries. For Native American, military personnel, and veterans, America follows just a socialist model, where the government acts as both the payer and the provider of health. And, by the way, this is one of the best health care in the United States, the one provided to military personnel, veterans, and Native Americans. For those over 65, the American model is very close to the Canadian single-payer model. The government ends up acting as the insurer, while the private sector provides the medical services. That is the system for Medicaid that most seniors use in the United States. And for uninsured Americans, those who do not have an insurance experience a health care quality similar to that of poor people in various underdeveloped countries. Most of the medical facilities under this group of peoples are too expensive for them, and they are left with virtually no health care. Basically, the quality of health care for uninsured American citizens is almost non-existent.
One of the things people know about me is that I usually don't watch regular news programs, particularly Fox News. I hate those peoples. But I don't watch much CNN either. I consider all of these news programs to have serious problems with the real issues Americans should know about. These news networks that I just mentioned do not play a role in educating the American public. Last night something weird happened. I came into my room and my wife was fall asleep with CNN on the TV. I was going to turn it off, but this guy was speaking about healthcare in the United States and how to fix it. The name of this presenter was Fareed Zakaria. I have seen his face on TV, but I never actually sit down and watch his program. He's talking about fixing healthcare system in the United States for sure. He must be one of these Republican guys which say that Obamacare is bullshit, and of course it's bullshit, but not in the way that most conservative people think. It should be more social than it is. But basically, he interviewed some guy who wrote a book relating to healthcare. The results are quite interesting, for not to say. United States is almost last in every one of the measured benchmarks, but is the most costly healthcare system in the world. So I started to watching that, very skeptical, but at the end I really liked the results. Watch what Fareed Zakaria said, and then we'll talk a little bit about it.
Healthcare in America, it is the costliest in the world, but is it the best? Not according to a report by the Commonwealth Fund, which actually ranked the U.S. dead last in a study that included 7 nations. Now, the challenge here in the United States is not an easy one: improving the quality of care while lowering the cost and expanding coverage to all of those people who don't have it. It's why Fareed Zakaria is devoting his first GPS special of the year to laying out a roadmap for saving health. Fareed, you have searched the world for a solution to this healthcare issue to try and map that onto the United States. What have you found?
Well, you know, in Taiwan, which is a free market country with a very vigorous free enterprise system, they had a totally free market healthcare system in the 1990s. They asked themselves, we want to go from scratch and build a new one. And they studied all the models in the world. And we asked the guy who designed the Taiwan healthcare system, what did you learn from America?
Right.
He said it was very easy. From America, you learned how not to do it.
Wow.
He said that there was really nothing they could borrow from the American case. Our system is just a total mess. In Taiwan, what they decided to do was they decided to go for a single insurer, but private providers. So the hospitals are private, the doctors are private, but you have a single, essentially government-sponsored insurer.
Right.
In other words, Medicare.
Right.
And not
paid for by tax dollars?
Paid for by tax dollars. Not surprisingly, they have the lowest healthcare costs in the world. They're up there. They're among the best in terms of the outcomes, but they only spend 7% of their economy on healthcare. We spend 17%.
And we're going to take a look at a chart which shows the steady increase in per capita spending on healthcare in the United States, or as a share of GDP, let's put it that way, starting at around 5% in the 60s up to this 17, 18% that we've got now. Fareed, let's just discuss this for a second, because there are some people who think market-based systems work best where there's competition, and yet some of the most efficient healthcare systems in the world are single-payer. Whether you want that to be a socialized medical system or just like you described in Taiwan, one payer that has efficiency and has the ability to control costs through negotiation. Square that circle for me, because one seems inherently anti-capitalistic.
Healthcare is a very weird field. There was a Nobel Prize-winning economist, Kenneth Arrow, who in 1963 wrote a brilliant paper predicting that healthcare wouldn't work on regular market economics lines. And here's the reason why. You don't know when you need to buy healthcare, and at the moment you need it, a heart attack, a stroke, a hip replacement, you don't have that much money. So you can't, the normal market can't function. You need an insurance system of some kind.
Right.
Now, of course, it's possible that you were to say, well, look, you know, the market would work if you were to just say, you had a heart attack, you can't afford it, sorry, you die. But every rich country in the world has decided that's not how we want to run things. We want to give people some basic access. And once you make that decision, you have to have an insurance system. You talked very correctly about the issue of access and cost. What I found is that every other system in the world found, in order to bring down costs, you have to have universal coverage. Because otherwise you have a downward spiral in insurance where basically the insurers try to kick all the sick people off the system.
And keep the healthy people on, who don't really want to get insured in the first place.
And the healthy people don't want to buy insurance. So it's a kind of, it's a weird game where everyone's trying to game the system.
So these countries that use a single-payer system, that take the money out of taxes, by doing so, that means everybody pays into the system, sick or healthy. Here in the United States, that's the part that's under challenge at the Supreme Court. The idea that this administration's healthcare reform plan wants to compel people to buy insurance in the same way that Taiwan taxes, in the same way that Canada taxes or the UK taxes.
We actually have a perfect example, and we talk about this in the program. Switzerland, 20 years ago, had exactly the system we do. And again, Switzerland, very free market country. Actually, Switzerland ranks higher than the United States on the Index of Economic Freedom, which the Heritage Foundation puts out. The Swiss realized 20 years ago they were having all the problems we are. The ones we were just talking about. The healthy people don't want to buy it. The sick people keep getting thrown off by the insurance companies. So they went for an individual mandate. Pretty much reformed the system along Obamacare lines. The result is they've had lowered costs, higher quality, huge customer satisfaction. So I can't speak to the constitutional issues, but what I can tell you is every system has found that if you don't create some kind of either individual mandate or, as you say, just a simple universal system, the model can't work because you have to bring everybody in to spread the costs, to spread the risk, and then you work on the really tough part, which is cost control.
Sure.
And that means you've got to have somebody, you can call it what you will, it has been demagogued as death panels, but you've got to have some board of experts saying, this is covered by insurance, and this is not.
And again, that is something that happens in many countries.
Every other country.
Where a 93-year-old person who is in hospital with some, what would be a terminal illness, isn't necessarily deemed to be chronically ill at that point. There are decisions that are made about whether or not this is worth spending. Sanjay often says that we spend most of our healthcare money in the last months of life, the last year of life.
The two crazy statistics about healthcare: 5% of the patients account for 50% of the costs.
Right.
So when people say, high deductible plans will work, no, they won't, because the real costs are all in those chronically ill, those seriously ill, who would be covered by catastrophic insurance or anything. And the second part is we fight death.
Yeah.
Most other societies at some point accept it. And at the end of the day, nobody's saying you can't, at 93, get that second hip replacement. The point is, insurance won't pay for it.
Right.
At that point, the market does kick in. You can do what you want. The point is, your insurance program can't pay for it. Otherwise, the whole system goes bust.
You're prepared for the fact that you and I are both going to get hate tweets about this, right?
You know, what I've tried to do is really ground this in fact. What I've been struck by is that the whole argument against some government involvement, first of all, ignores the fact that we have huge government involvement in Medicare. Is basically
remember that sign during the objections to Obamacare which said, "Government, get your hands off my Medicare."
Right. But the second part is that everyone who makes these arguments against the government, there is some fantasy theoretical version of healthcare that they talk about. But you know, I'm a practical guy. What I say is you can reason from principle, but you also got to reason from facts and reality. We have 20 other countries in the world that do this. All of them are able to do it better and substantially cheaper than us. So to me, it feels like the task is not to junk all this and say there's some utopia out there that's never been tried in any actual human society. Rather to say, look, we've got a messy reality with the government and markets working together. Let's fix it.
What you can take out of this intervention of Mr. Zakaria is that there is no other health system that is efficient other than the one that is promoted or funded by government. In the past 5 years, there have been a trend in the United States to sell the idea to the general public, which, to be honest, it has been a very successful campaign, that tax dollars should not be used for globalized health system. They find this kind of system to be socialist, and they forget or omit on purpose to say that most of the best health systems in the world are socialized in such a way. Another topic that was treated in this program was about a book who tried to answer the question of how to fix the health care system in the United States. The book, The Healing of America, A Global Quest for Better, Cheaper, and Fairer Health Care, is written by the journalist T.R. Reid, and it is a bestseller. The book gives off an overview of health care systems in several different countries and contrasts them with health care model followed in the United States. The countries whose system is discussed are France, Germany, Japan, the United Kingdom, Canada, and a specific example from India. Reid visited all these countries personally and claims to have chosen them as they exemplify a specific kind of healthcare system models. The book also discusses transition in healthcare systems of Taiwan and Switzerland. The major theme of the book is to contrast the healthcare in other developed countries with the one in the United States. Reid is critical of the United States for not being able to provide guaranteed health services to all its citizens in a manner done in virtually all developed countries. Let us hear what Mr. Reid has to say about the American health system.
This transplant costs tens of thousands of dollars. But under Britain's National Health Service, or NHS, the patient doesn't pay a thing.
When patients come to us, we only evaluate them from the point of view of their need. Do they need a liver transplant? The cost never comes into it. As a surgeon, I love that because it means the focus is on the care that I can deliver.
Of course, the Brits do pay for their health care in another way, with taxes. The NHS is Europe's largest employer, with well over 1 million people on the payroll. So you'd think it would be inefficient.
That seems sensible, right? The private sector can do things more efficiently. It doesn't work in healthcare.
T.R. Reid, a former overseas bureau chief with the Washington Post, toured the world's healthcare systems for his recent book, The Healing of America.
The least efficient payers in the world are the American private insurance companies. They have administrative costs of 20 to 30%. That's a 30% tax on every dollar you spend on healthcare. Britain is totally socialized medicine, administrative costs 5%. Canada is private doctors and public payers, 6% administrative costs. So it turns out in healthcare, governments are doing this more efficiently than our private sector.
This Farid Zakaria hit the nail in the head, and I really think it's an excellent report. I am sure CNN will not air it in any prime time and will not comment about it. He also published an article in Time magazine talking about the same thing, and I think the article is also very good. I read it. You can search for it. And I thank you for your attention. See you next time.